Hey guys, it's Caden. Welcome to another Autism Digest interview. Before we begin, I'm happy to announce that we just hit 368 subscribers on the YouTube channel. I wanted to thank everyone for supporting the channel. Also, I remember when I first started doing these for this company, we were at 35 subscribers. So I'm extremely happy to see the amount of growth this company has achieved. So like I always say, keep on subbing and we'll keep on providing you amazing content. The second thing I want to address before we start this conversation is I'm not a licensed medical professional. No, I definitely wish I was. But anything we discuss here should be brought up with your doctor. With that said, let's get down to business. Today's guest is a licensed cardiologist. He's had over 1,000 peer-reviewed articles over the course of his career, and he's been on Joe Rogan, Newsmax, a bunch of different platforms. I wanted to bring him on here today because right now there's a lot of discussion going on about autism, vaccinations, and Tylenol. And at Autism Digest, we're all about offering different perspectives on autism. So I want to sit with this individual to discuss where America stands when it comes to autism awareness, and most importantly, how not to judge anyone by standards when it comes to medical decisions. With that said, I'm happy to introduce Dr. Peter A. McCullough. Thanks for coming on, Dr. Pete.
Well, thanks for having me.
All right. I think a lot of people might remember you. You have hundreds upon thousands of subscribers on YouTube and Instagram, and you've been on Joe Rogan. It doesn't get much bigger than that. But for those that may not know you, do you mind giving us a summary of your story in your own words?
Well, I'm in practice as an internist and cardiologist in Dallas, Texas. I'm also, trained as a research epidemiologist, and I do, practice, very active research investigation. I'm president of the McCullough Foundation, which we have a whole investigative team, and then I become a public figure through the course of the pandemic. People have relied upon my advice in so many areas. And in my most recent book, which is a New York Times bestseller, Joe Rogan, who you mentioned on the back, said, Dr. McCullough was right about everything. So I'm very careful. I cite the data, and I keep track of it. I do a lot of interviews, as you can imagine, thousands of them. And so I'm careful with my insights, and I've been on target with respect to these big issues. So I'm greatly interested in autism as in a bundle of neuropsychiatric disorders in childhood. And I'm also greatly interested with Parkinson's and Alzheimer's disease in the senior years. Both of my parents developed Alzheimer's disease. So I'm personally very, very interested in that.
I can definitely tell you're passionate about your craft, and I see you have some degrees and awards in the background there, so you definitely know what you're talking about. My next question for you is, over the course of your medical career, have you had any experiences treating autistic patients? If so, what's your advice for anyone on the spectrum who might be overwhelmed when it comes to medical visits?
Mm-hmm. Well, I certainly have had increasing numbers of patients who have autism spectrum disorder, as they grow out of childhood into adulthood. I had a man with I would characterize relatively severe autism. He had kind of lifelong needs, and he just died of heart problems in the last year or so. But he was 80 years old, so had a chance to kind of review his case. So you can imagine someone who was born, in 1944, and about what potentially he could have been exposed to as a child, or what other factors could be determinants in his case. But he clearly had the syndrome. He met the central features of the syndrome.
That's amazing. And I know the doctor's office can definitely be overwhelming for a lot of autistic individuals. So going back to part two of the question, as a doctor yourself, what's your tip for any autistic individual who might be overwhelmed when it comes to going to the doctors?
I would suggest writing down questions. Don't have too many of them. Really focus on listening. Don't be afraid to, repeat a question if you don't understand the answer. And, just try to process the information. You'll always get second and third chances to ask more questions. And, I recognize it can be intimidating. It was for this patient. But I have seen increasing numbers of patients with autism. And when I was a medical student in the early 1980s, I can't remember a single individual that I encountered with autism. And the classes that were taught, it was simply, there were two terms that were linked together in textbooks, and we never really discussed them. One was autism and mutism. Mutism means unable to speak. And they weren't thoroughly explored. There weren't lectures in medical school, even through residency or fellowship. And one of my observations is autism, which I believe is a big problem now in pediatrics and young people. It's relatively under-researched and under-discussed by doctors.
I absolutely agree with that statement. I definitely believe that autism needs to be studied way more than it is now. Oh, it's amazing to see how far the autism community has come and the resources that are out there now. But I really like what you said. I think to truly understand autism, more research needs to be done. Which leads me to my next question for you. Recently, the White House held a press conference and said autism is caused by Tylenol being taken during pregnancy and some vaccinations. As a licensed medical professional, what's your opinion on that?
Well, this issue of taking Tylenol during pregnancy has been investigated since 1996. So it's relatively an old issue in medicine. Keep in mind, when a woman becomes pregnant, the only safe medicine to take to control a fever without risking the baby, the placenta, and the uterus is Tylenol. That ibuprofen or naproxen sodium or other non-steroidal agents can't be taken. And so, it'd be ideal if a woman didn't take any medicines during pregnancy, have the most natural pregnancy possible. But 3 large studies show about 2/3 of women actually do end up taking some Tylenol during pregnancy. And there can be a whole range of indications. And as studies were done, and they largely were based on recall. So a woman would be asked to recall what happened during pregnancy and without any quantification of dose or duration or clinical indication. It was simply Tylenol exposure, yes or no. There was enough there for the US FDA to put out a warning in 2015. So it's nearly over 10 years ago, that that use of Tylenol could be associated with ADHD later on during life. And then there were some, I think, very definitive studies done. One was by Altquist and colleagues, published in JAMA in 2024. And this was 2,000 Swedish mothers. They collated the data from over 20 years. They had midwives quantify how much Tylenol was given in the first, second, and third trimester. And they even did a study of siblings. So, if one sibling in a pregnancy had some Tylenol exposure through the other and the other one didn't. I mean, this is far and away the best scientific study of all. And, it was published in probably the best journal of those investigations. And they had very good ascertainment of autism, ADHD. And the conclusion was no association whatsoever. And I do think that this was largely confounding by indication. That means, it's potentially the reasons why a mother took Tylenol could be behind the link, but not the Tylenol itself. And what struck me in the Alquist paper is about 15% of mothers who took Tylenol, they actually also took opioids like OxyContin or morphine or oxycodone. So, that's a proxy for they were sick with other things as well. So the American College of Obstetrics and Gynecology came out last week and said, no panic. If we have to use Tylenol, it's fine to use it. So did the MHRA in the UK and about a half dozen other organizations. And so I think on this one, I think that's the right call. And it'd be ideal. I check with my wife. My kids don't have autism, but my wife, never took any Tylenol during pregnancy. I did get a ton of correspondence on social media. And many mothers said, listen, Dr. McCullough, I wasn't going to take Tylenol, but I was told to take it because I was getting vaccines. So vaccinating the mother, that's just started in the last 25 years. It wasn't done before 2003. And so mothers receive the tetanus, diphtheria, and acellular pertussis, the inactivated influenza vaccine, COVID-19 vaccine, and respiratory syncytial virus vaccine. And that's relatively new. And so the women were pretty clear about this, that they were told to take Tylenol because if the vaccines provoke a fever is the stimulus for the mother to lose the baby and have a miscarriage or a stillbirth or even a premature delivery. So the consequences are pretty high. We don't want pregnant women to get fever. But that's what we know on that update.
And I absolutely agree with that. And here's another thing I wanted to point out to you specifically. I've told this to a lot of people when discussing this. The first autism diagnosis was in 1944, specifically Donald Triplett. Tylenol was brought onto the market mainstream in 1950s. So if Tylenol truly is because of autism, which it is, then I'm still skeptical about it. Wouldn't there have been an increase in autism cases in 1950? So I definitely like what you're saying. My next, go ahead.
Yeah, just to follow up on that, you're right. It was widely introduced in the 1960s, and these concerns really weren't raised to the 1990s. They largely weren't raised until the era of women receiving vaccines during pregnancy, and I think that needs to be investigated. But you're right. Our research indicated the first case of autism may have actually been in the very late 15th century. So it's hard to know, right? Because back then we didn't really have any standards per se, but there were sporadic cases. Look at my patient, who I can tell you as a doctor, I can tell for sure he had autism, for sure. And the onset of his diagnosis was probably 1946.
Exactly. Autism has been around for generations and long before modern medicine. So you definitely bring up a good point. So speaking of standards, my next question for you is, it seems like nowadays there's a lot of conspiracy theories surrounding some medical information, especially autism, and people are afraid because of that misinformation. You sent me something before the interview about being careful utilizing that word. So my question for you is, how can people continue to make their own medical decisions without judging anyone by standards?
Well, I think it's important just to avoid those propaganda terms. So you mentioned one of them, conspiracy theorist, and it turns out that's an FBI term. That's where it came from, the intelligence community. So, the way to think about this is we all have theories about things, particularly illnesses or situations where there is no definitive answer, right? So there's no, clear-cut single cause that anyone's been able to identify of autism. So, and particularly when we're down to what we call epidemiologic risk factors. So, we don't have conspiracy theories. We basically just have rational theories. And the way the science advances, Caden, is what you and I are doing, that we discuss things. So we don't want to use the word conspiracy theorist. Now, misinformation, that's even a more difficult one, because that came into the English language around 1500. It was used extensively during World War II by the Third Reich. In fact, the Office of Goebbels used misinformation. And so the way it was used is if you could cast somebody else as spreading misinformation, then one could seize this moral authority. One could have leverage that they hold information and somebody else is spreading misinformation. And so it was, that propaganda, which is a way of people pressing their views on others, that was used against people who disagreed with Adolf Hitler. And then later on, a similar term, disinformation, was heavily used by Stalin in post-World War II Eastern Europe. So I have cautioned people in the podcasting world and in the media, just don't use these terms. We simply have observations. We're going to cite the data, and we're going to develop our opinions, but we don't need to kind of exert leverage over one another. You know what I mean? I think that's the difficulty. And recently I testified in the U.S. Senate, and one of the senators used misinformation. I said, don't do that as a public servant. I don't want to see that anymore. Let's just discuss the information without trying to exert leverage over one another.
Exactly. I really like that. Not just with the medical field, but in the current state of the country. The big problem is we're judging people by standards and stirring up fears and thinking we need to fearmonger and use these big words to think we have power over someone, when really it should be all about discussing something and agreeing to disagree. It's that simple.
Yeah, we certainly can. We can end up in disagreement, or hopefully what we do is we'd end up in advancement in our understanding. And so anytime we have a novel problem, let's say the COVID-19 pandemic, misinformation really came on the scenes. It became a National Library of Medicine, was considered mesh heading. And now there are misinformation scientific indices. So it's crept its way into the medical literature. And I don't think it has a place, because anytime you use that word, we can't have a level conversation, right? So if one of us accused each other of misinformation, we suddenly have a leveraged situation. You can tell how uncomfortable that is. So I always tell people, listen, it's the golden rule. Treat people how you want to be treated yourself. I wouldn't want anybody ever to say that I'm spreading misinformation. And I wouldn't do that to anybody else either.
And that's why I have you on here. I definitely don't agree with some of the things you said in the past, but we're open, we're discussing things, and this is how we move into a future where we don't judge anyone by standards. We talk things out, same as anyone else. Which leads to my last question. What does the future hold for you? Do you have anything you want to promote?
Well, McCullough Foundation, which is located in Dallas, Texas, we're a 501c3 organization. We're about to finish a very comprehensive report on the risk factors for autism, and that will be presented and published. And then we're going to launch a series of investigations. Do you know what's really missing in the entire scientific investigation of autism is really detailed interviews of the parents of the children with really that granular information. I don't think we can do this by trying to use ICD codes or other types of codified data. We actually need to interview parents. And we need to really seize this idea of siblings. So if there's two siblings, you mentioned you have several siblings in the house, to examine all the siblings. I do think in autism, we need development of various types of imaging of the brain, just like that's been helpful in Alzheimer's and stroke and what have you. So advanced brain imaging. And then we need advanced blood testing. I think this is going to be very important. None of those have actually been done in the autism field. There hasn't been a significant advance. And I've been pushing our agencies, which have a lot of resources. Our CDC has 12,000 employees, over a $9 billion budget. And there's been essentially little or no high-tech investigation of autism. They have a 16-center Autism Network, which they're capturing cases by codified data, but they're not investigating the origins of autism. They're not investigating any treatments, how people can get better. And in my field in cardiology, we've had investigations involving tens of thousands of patients to study cholesterol, blood pressure, diabetes, coronary angiograms, echocardiograms. We've had randomized trials of therapy of 40,000 individuals. Autism is such an important diagnosis. I think we should have the same effort that we've had in heart disease and autism. So I'm trying to stimulate others to really get going on this. I don't think anybody finds it acceptable now that another child born today, within a few years, could develop autism. The parents want a normal, healthy baby growing all the way up through, normal development without having these extra challenges. Life is hard enough as it is.
I really like that. That's actually a really good idea. It's the best of both worlds. You get the perception of people who lived it. I think we should add high function level 1 autistic individuals to the mix too. Because life is hard for us as well on the social side of things. Talking with parents, siblings, grandparents, doing more blood tests to see what the underlying causes of autism are. Absolutely, like what you said, we should put the same level of effort into autism and neurodiversity as a cancer or high cholesterol or anything you study in the cardiology field. So I'm definitely looking forward to reading that paper once it's out. Anyways, that's going to do it for this interview, guys. Thank you so much to Dr. McCullough for coming on and sharing his perception on everything. This will actually be the first in a series of interviews about this topic where we bring on medical professionals to discuss their points of view. So if you guys want to see more amazing interviews, be sure to like, comment, and subscribe to the Autism Digest channel. Stay tuned for our November issue that's coming out next month. You can get that by going to autismdigest.com. And stay tuned for the audio file of this to be posted on our Spotify. Thank you guys so much for watching, and we'll see you in the next one.